I believe the pandemic's really heightened awareness and the frequency of hand hygiene at work, but also in nurses' personal lives, and mainly because of the government's public health messages early in the pandemic around the need to prevent infection. Higher rates of hand hygiene has, I do believe, led to reports of more sore hands because of this. And although that's anecdotal, I do hear and read more references to hand cream and emollients these days than before the pandemic. Well, most nurses tell me that time is a huge factor in terms of using hand creams, as they're constantly rushed off their feet. Nurses will prioritise hand hygiene for patient safety over their own skincare, as it eats away from time they could spend with patients. Time pressure is almost certainly down to staffing shortages, and we know there are tens of thousands of nursing vacancies across the NHS and adult social care at the moment. So this all adds up to put extra pressure on nurses whilst they're at work. There needs to be a culture change across health and care towards staff health and well-being. And although this is already present generally in things like the NHS People Promise, it needs to be tangible during the working day. So things like the ability for staff to take adequate breaks and for them to take time to care for their hands in practice. This needs to be happening. This might be something as simple as physical time to consider hand care or time to go to occupational health for advice when at work. So yes, absolutely. The RCN undertook a large survey in 2020 which identified the extent of issues relating to members' skin health. Half of the respondents rated the condition of their hands as either poor or very poor, with dryness as the most common symptom experienced. But nurses also reported redness, itching, and cracked skin as common symptoms. As a nurse, if your hands are sore and cracked, it's impossible to use hand sanitizers, and hand washing also becomes very problematic because exposure of the skin to water and soap exacerbates sore hands. We know through our contact with a wide range of RCM members how debilitating sore hands is and how it can affect not just the individual nurse but employers as well because of time off due to the condition. We are actually also aware that some nurses have had to leave the profession because it was simply not possible to resolve the extent of their dermatitis on their hands. Yes, historically, I do recall that there was a perception of poor skin health linked to the use of hand sanitizers, but that was some time ago. Nowadays, the products are very different and of a much higher quality with respect to emollients and general acceptability by staff who use them frequently. I don't believe current perceptions link specifically to hand sanitizers, but more the sheer frequency of hand hygiene that needs to take place throughout the working day. So yes, I have almost daily conversations with nurses around PPE, and most of them are appalled by the amount of waste generated during the pandemic. They know, of course, that PPE is essential for their safety, but calls for reusable or recyclable PPE are growing in order to balance the need to protect our planet. Unnecessary waste is a difficult term to capture. We need to be much better at segregating waste into the correct category and for trusts to move to more sustainable waste management, but that's not the responsibility of individual nurses per se. If the only bin provided is a clinical waste bin, then that's all that they're able to use. Space is also at a premium in healthcare facilities, so there simply isn't the room for more recycling locally in wards. Of course, all of this will only work if nurses have more time to do the right thing, and that's down to the need for more nurses and a strong sustainability culture where they work. Yeah, nurses often underestimate how powerful their voice is, either as an individual or as a collective. My advice is to find someone where they work who can support them or work with them. So someone that's also passionate about making change, essentially. Find out who your local sustainability lead is, or make contact with your specialist procurement nurse. These are key people to get to know. Nurses can also get involved in RCN activity or undertake our sustainability programme being launched in the autumn, and there's more information on the RCN website.